Are you confused about choosing between Medicare Advantage HMO versus PPO plan? You're not alone. These days, we are going through open enrollment period and many patients who actually physically showed up in my office asking me what is better for them. As a primary care physician, I am not in a position to explain or recommend you a specific plan or the other, but I will go video general concepts which I think is important that you could make a informed decision and you could pick up right primary care and right plan. Hello, my name is Dr. Kundlas and I'm a primary care physician for last 27 years. I have been around and I have seen multiple health plans coming and going and benefits of both HM and PPO plan in different patient groups. I would say understand what I am going to simplify in this video and then figure it out for yourself what will work for you. In HMO, you have group of doctors which whether primary care or specialists, they are contracted with them and they agree to accept patients from those insurances and take care of them in their offices. You are restricted to this network whether you have a HMO plan or a PPO plan. In HMO plan, you are assigned a primary care who is your primary healthcare navigator, coordinator, who will look over everything what you need and will discuss with you or should discuss with you and determine what you need and what you do not need. And it is a shared decision. But the key component is you must have primary care physician. And if you have to see a specialist, you must first talk to your primary care and then your primary care physician works with your insurance, get you app codes and send it to specialist. So for you to be referred to a specialist, you need a primary care. So far, it is well and good because that's how healthcare system is supposed to act, provided the PCP is really acting in good faith and they are truly providing you with proper access to healthcare, then they are also doing their referrals, meaning that they have infrastructure to communicate your needs and demands to your health plan and coordinate and make a specialist appointment. Whereas in PPO, you do not need primary care. You could go by yourself and see any specialist in the network. You also have a capability of going out of network, but you will have more co-payments and deductibles. Both HMO and PPO have a network. In HMO, you need a primary care who will coordinate your care. He is your quarterback. In PPO, you do not have any quarterback and you could go to any specialist. The fundamental then to decide between HMO and PPO is financial. I have realized this, they were making it as a quality issue. I don't believe it's a quality of care issue. I truly believe that patients who are enrolled in Medicare, they get better care. One, your primary care knows you more thoroughly what the PPO patients usually get from their primary care. Also, when you go and see a specialist, you are going with proper notes, backup data, so that the information is conveyed from one provider to another provider in a proper way. And so you are not like a witch hunt when you go to a specialist. They are starting from scratch or starting from your basic minimal symptoms and they're going upward. Other major point is the specialists are very narrow and very focused. That is their expertise. They can zoom in into a problem and take care of that. Whereas your primary care physician has a wider outlook. Their primary care provides you holistic care. I think bypassing primary care in any circumstance, whether you are in an HMO plan and PPO plan, the key is good primary care office with the strong processes to process your referral. If you are going to multiple specialists, you need a quarterback who will tell you what is significant, what is not significant. At the end of the day, it is your money. which is important. So I have very clear understanding, and I have made it as a mission for our practice that we will provide our patients with quick, comprehensive, and cost-effective care. That is what America needs. It doesn't need haywire care where you are running from one specialist to another and they do not know you as a whole. You need coordinated care where your primary care is your quarterback. He's guiding you all the way. And then the other advantage of HMO plans is if a primary care physician has sent you to a specialist will send the consults. You may understand half of the things which specialist told you, or the specialist is focusing only on one part of your health. And your primary care can look at you globally and they could explain you what that test information medication had as a holistic you rather than a one isolated organ, whether it's your heart or kidney or liver or any other. So you will get a coordinated care rather than chaotic and disorganized care. In the end, your decision to whether you go to HMO plan and PPO plan is purely financial. You must work on the network of PCPs if you are planning to go on HMO plan. Look at the quality primary care physicians in that insurance network and go and visit them the way few of you came to our office today. Ask intelligent, meaning how long it takes for you to get appointment for urgent, non-emergent, and any other issues you may have, including your preventive care. Then what is their referral process? If you find a primary care physician who provides you open access and you could come to them all the time and they process your referrals in a timely fashion, in my opinion, better off getting a coordinated care rather than chaotic and haywire care which PPO networks provide. Regardless, both the cases, you are restricted to network. Out of network expenses are extremely high. So I do not believe anybody can answer this question black and white. I would say if money is not the issue, then you could pick anything. But I will still prefer HMO because your care is coordinated and you will get appropriate, quick, comprehensive, and cost-effective care. But if you are financially constrained, you have no other choice rather than going with HMO, then the second differentiator is your primary care and his or her support staff. Primary care may be the best, but if they do not have the support team, because it's a team effort to take care of you, then you will be having a very difficult experience. So look at financially which one works best for you. I still think HMO can provide you with more coordinated care. But if you like freedom and you're financially well off, you should consider to PPO plan. Some of our residents in Florida, they travel back and forth where they technically 6 months in some different states where HMO plan may not work for you. So look at your finances, look at how much freedom you want. But I would say before you make any decision, look at insurance network and look at especially the primary care and their processes. I was really proud when you guys showed up today in the office and we had a very intelligent discussion around this topic, and that has prompted me to make this video. Hopefully it was helpful. I will make another video on Medicare donut hole because last 1 month we have gotten a lot of questions. So stay tuned for that video. Further, we have a lot of videos on our channel Kundlas MD regarding different disease process, preventive care, and business of healthcare. I will see you in one of those videos. Thank you very much.